Good afternoon, colleagues. Thank you for joining me today as we discuss the crucial and often overlooked elements of ethical communication and research integrity in quality healthcare and allied health practices. Our focus will be on ethical issues and their implications in research, especially as they relate to how we communicate. As healthcare professionals, we do more than deliver direct patient care, as we also contribute to the body of knowledge that shapes future treatments, safety protocols, and patient outcomes. For this reason, it is essential that all forms of communication, whether written, verbal, or research based, are approached with integrity, transparency, and accountability. So let's get started. The first is going to be on principles of scientific communication. First, let's review the 5 foundational principles of ethical and effective scientific communication. The first will be accuracy. The second is going to be clarity. Third, honesty. Fourth, transparency. And fifth is objectivity. These principles ensure that our research findings and clinical documentation meet the highest standards of professional integrity. Scientific communication isn't about sharing results. It's not just about sharing results, but it's about doing so in a responsible, reproducible, and respectable way, regardless of whether the outcome aligns with your hypothesis. Ethical implications in human research is next. And let's consider the ethical obligation we hold when conducting human research. Whether we're collecting data, participating in studies, or implementing quality improvement initiatives, we are ethically bound to certain protocol. First is obtain informed consent. Second, protect patient confidentiality. Third, minimize harm to the patient and anyone involved. And fourth and final is respect patient autonomy. We must take special precautions when research is involved with vulnerable populations, such as children, pregnant individuals, or those with cognitive impairment. There are not just procedural formalities, they are moral imperatives designed to safeguard human dignity and uphold fundamental rights. Our next section, we're going to look at historical context and regulatory safeguards. History has taught us hard lessons. Egregious violations in human rights, such as the Nazi medical experiments during World War II, the Tuskegee syphilis study, led to the establishment of regulatory safeguards, and this includes institutional review boards, or IRBs. These boards now play a critical role in ensuring that research is conducted ethically and in accordance with federal regulations and state law. Ethical failures in communication, such as misrepresented data or omitted key information, or using misleading language in consent forms, this can all erode public trust and lead to serious consequences. And we are obligated to be transparent about our intentions, clearly explain both risk and benefit, and report our findings honestly, even when the results are unfavorable. Everyday ethical communication in our day-to-day interactions. Ethical communication also extends to how we engage with patients and their families, colleagues and interdisciplinary teams, and diverse populations with varied culture and linguistic needs. This requires active listening, being empathetic, cultural sensitivity, and the use of plain, accessible language. To provide information in a patient's primary language or recognizing cognitive limitations is not just best practice, it's a matter of respect and inclusivity. We also must remain within our professional scope and communicate respectfully across all disciplines to promote safe and collaborative care. Next, we're going to talk about principles for ethical research. insight for I researched some literature recently, and according to the principle for ethical research involving humans, I've identified 5 overarching goals for ethical education among healthcare professionals. The first is stimulating and broadening moral imagination, which includes developing empathy and the ability to view context through all ethical lenses. The second is recognizing ethical issues, becoming more aware of how and when ethical dilemmas arise. Next will be developing analytical skills, gaining the vocabulary and reasoning tools to evaluate ethical situations at all times. Eliciting a sense of moral obligation and responsibility, understanding one's ethical duties on both personal and professional levels, and finally, coping with moral ambiguity, navigating situations with no clear moral answer through reasoned, defensible decision making. These principles all emphasize the ethical practice that it's not static. It is a continuous, reflective process embedded in our daily work. In conclusion today, I'd like to speak on ethical communication and research, and in all areas of healthcare is about much more than what we just say. It's about how we respect others, protect their human dignity, and uphold the core values of our profession. Let us carry these principles forward as we continue to grow, not only as healthcare providers and researchers, but as advocates for the individuals and the communities we serve. Thank you very much. Do we have any questions?